What are the signs that you have fibroid? Well, the best way to know if you have fibroid is to go for a pelvic abdominal scan. But for those who are still lingering, who are doubting, or you need something to push you to know that, there could be fibroid in your system, one of the first places to check if there could be fibroid in your body is to look at your menstrual symptoms. Is your period long and heavy? A normal period should be between 3 to 5 days, but if yours is longer than 7 days, there could be fibroid. And if it's also heavy, like you can't use one pad like use one pad in less than 1 hour, you should go for a pelvic abdominal scan to confirm. Secondly, you pass out very large clots, blood clots during your period, there could be fibroid. And lastly, you feel abdominal pain. Feel abdominal pain, there could be fibroid. Also anemia. Yes, due to the long and heavy bleeding, your blood volume may go low. And if anemia is present, you experience headaches, dizziness, dry skin, fatigue, and so on. So that's where to check. The first place to scrutinize for fibroid. Secondly, you check your urinary and your bowel system. Do you urinate often, frequent? Is your urination urgent? Like if you feel like urinating, you can't hold on, you must use the restroom, there could be fibroid, because when fibroid grow big, it presses against the bladder, which can cause this. Also, do you have difficulty emptying your bowels? Like you go to the toilet to ease yourself and it's difficult to pass out urine. It happens when the fibroid or the urethra is blocked, that can cause that. Also constipation. If you are battling with constipation, that's because fibroid can press against the intestine, the colon. You need to go for a pelvic abdominal scan to confirm. Then another place to check is just general body pain. Do you feel lower back pain and leg pain? You need to go for a pelvic abdominal scan. There may be fibroid. Do you also have abdominal distension? There could be fibroid. Do you also experience painful sexual intercourse? There could be fibroid. Lastly, if you are battling infertility, you've been trying to conceive, but in for at least a year of having unprotected sex and you've not yet conceived, you should go for a pelvic abdominal scan. And that is how we can now know if there is fibroid, the size of the fibroid, and the location of the fibroid. And if there is fibroid, there is a holistic approach to handle it, free, no adverse side effect, non-invasive, and highly sustainable. It won't come back. Thank you.